Om Dham Dhanvantare Namaha. Karpuragauram Karunavataram Samsarasaram Bhujagendraharam Tadavasantam Hridayaravinde Bhavam Bhavani Sahitam Namami. Let me share. So today's topic is chest X-ray view, pleural effusion and lung collapse. The study of pleural effusion and lung collapse. Pleural effusion means there will be accumulation of excessive fluid in the pleural cavity. Lung collapse is also known as atelectasis, where one lobe or entire lung is collapsed due to air leak. Uh, air leak. So, pleural effusion is caused due to conditions like lobar pneumonia, pulmonary tuberculosis, and pulmonary edema, conditions of pulmonary edema in the last stage, and conditions of ascites due to nephrotic syndrome or congestive cardiac failure or cirrhosis of the liver or hyperproteinemia. Lung collapse is due to rupture of the pleural membrane and the leakage of air into the thoracic cavity, maybe due to stab injury or due to infection, pleural infection or other infections, or due to trauma. So there will be this accumulation of air in the pleural cavity, and the pressure inside the lungs reduces and lung tissue becomes collapsed. Here you can see pleural effusion. In the right side, there is uniform white opacity or ground glass appearance in the right lower lobe, near right lobe. And there is obliteration of the costophrenic angle, and the upper border of the shadow is inverted as shape. This is the pleural effusion in the left side. You can see the obliteration of the left costophrenic angle, and uniform white opacity, ground glass appearance, with the upper border similar to inverted S. Here you can see the right side, there is pleural effusion. There is obliteration of the costophrenic angle and uniform ground glass appearance, and the upper border being inverted S shape. Here, the right side, there is pleural effusion. The costophrenic angle in the right side is obliterated by the fluid, and the upper border of the shadow being inverted as shape. And once again, there is huge pleural effusion in the right side of the chest. That is uniform white opacity is seen. Here in the left side, you can see the pleural effusion. There is obliteration of the costophrenic angle in the right side, left side, and inverted as upper border. In the left side here, pleural effusion is there, and the costophrenic angle in the left side, right side. Costophrenic angle in the right side is obliterated, and upper border of the shadow is being inverted as shape. Here you can see there is right-sided pleural effusion. So the costophrenic angle in the right side is obliterated by the fluid, and there is uniform white opacity. Ground glass appearance is there on the right side. Here also is also one case of pleural effusion, right side. You can see obliteration of the costophrenic angle in the right side, and there is uniform ground glass appearance in the lungs in the right side. The upper border is S shape, inverted S shape. If it is tapped, there will be add fluid line, straight line will be there. There also right-sided pleural effusion. You can see, we will see the obliteration of the right costophrenic angle and uniform white opacity. This is again the case of pleural effusion. Right side is the obliteration of the costophrenic angle and the shadow, the upper border, in inverted shape. The left side, and there is also here also a left side, there is pleural effusion. Obliteration of the costophrenic angle, left side. Here, the right side, pleural effusion. You can see the obliteration of the costophrenic angle, the right side, with uniform ground glass appearance, lower loop, lower side, and there is inverted shaped border. So, coming to atelectasis or lung collapse, in the lung collapse, direct signs are displacement of the fissures, crowding of the pulmonary vessels. Indirect signs, elevation of the ipsilateral hemodiaphragm, hemidiaphragm, elevation of the ipsilateral hemidiaphragm, crowding of the ipsilateral ribs, shift of the mediastinum towards the side of the atelectasis, compensatory hyperinflation of the normal lobes, hilar displacement towards the collapse, and shifting granuloma sign. These are seen in lung collapse. So there are several classical rules that a lobar collapse follows. They are going or displacement of a fissure or of fissures occurs towards the collapsing lobe. A significant amount of volume loss is required to cause airspace opacification. Collapsed lobe is triangular or pyramidal in shape, with the apex pointing to the hilum. The collapsed lung periphery maintains contact with the costal parietal flora except in RMN, right middle lobe, collapse where the lobe collapses adjacent to the mediastinum in the presence of pleural effusion and in the presence of pneumothorax. You can see there is a collapse. Collapse of the right upper lobe is there. So there will be hyperinflation of the remaining tissue. You can see white opacity in the left upper lobe. Here also collapse is there. Right side. Here in the left side. The right side upper lobe there is a collapse. You can see the triangular white shadow with the apex pointing towards the hilum. Here collapse. The right lobe, right lung. There is hyperinflation of left lung. Sorry, left lung. Hyperinflation of the right lung is seen. Okay. That is here. Collapse is the diagram shows the collapse area. Triangular area with the apex pointing towards the hilum. Here in the right apical lobe collapse. Okay. Triangular white shadow with apex pointing towards the hilum. There is hyperinflation of the left lung. Here, the left apex, there is a collapse. The triangular white shadow there. Here, collapse of the right lung. Right opacity is there. Hyperinflation of reactive hyperinflation of the lung. The collapse of the left upper lobe. The triangular area is the white opacity. The left upper lobe. Here, left upper lobe, there is collapse. Okay. You can see white opacity, triangular opacity, hilum, the point towards the hilum, the hyperinflation of the lower lobe. There you see, there is a raising of the hemidiaphragm, also collapse. Right upper lobe is collapsed. There you see, it's collapsed. below. Today, we have discussed pleural effusion, the features, X-ray findings of pleural effusion, and lung collapse or atelectasis. Thank you for patient hearing.